Hi guys! So this baby is coming any week now, maybe even any day. And so I wanted to talk about skin topics related to pregnancy before I didn't have that excuse anymore. One topic that is common during pregnancy and well known to many of you out there is stretch marks. If you're just tuning in, I'm Dr. Abby Waldman. I'm a dermatologist at Brigham and Women's Hospital in Boston. As a doctor, I feel that I want to provide free, useful medical information for everyone that will actually help improve your life. Because I'm a dermatologist, the majority of what I talk about is related to skin and appearance, but I do touch on general health concepts as well. If you're interested in improving your life through medical knowledge, then please subscribe. So what causes stretch marks? Stretch marks are caused when the dermis, which is one of the top layers of the skin, rapidly expands or stretches during periods of rapid growth, such as pregnancy or puberty. So just to demonstrate, this is one of my toddler's toys. We call him Fat Cat. And so you can see that when Fat Cat is rapidly squeezed or rapidly stretched and grown, he gets a stretch mark. So stretch marks are so common in pregnancy. It's estimated that anywhere from 50% to 90% of women have some form of stretch mark that develop during pregnancy. As I mentioned, you can get them during other periods of rapid growth, such as puberty. You can also get them by taking chronic steroids, either by mouth or topical steroids. And that is because the steroids actually weaken the dermis. They weaken that top layer of the skin, causing easier stretching of the skin, resulting in stretch marks. They normally occur in fatty areas, such as the tummy, even the arms, the thighs, and they typically start out red and then become white over time. Though you might find them unsightly, remember that stretch marks are a badge of honor that you grew a small new human for 9 months. I've heard a lot of anecdotal tales about putting on cocoa butter or some other creams during pregnancy to prevent stretch marks. While a dermatologist is never going to tell you not to moisturize, everyone should moisturize, unfortunately, there's probably not great data to show that putting on moisturizers or cocoa butter or vitamin E oil, anything like that actually prevents stretch marks. While the data is murky, there may be some evidence that using a moisturizer such as vitamin E oil or hyaluronic acid or even just Vaseline might decrease the severity of stretch marks if you're going to get them. And all of those that I mentioned are safe to use during pregnancy. Probably the biggest predictor of whether or not you're going to get stretch marks is genetics. So you can blame your mom and certainly ask her if she developed stretch marks during her pregnancy. Once you develop stretch marks, the earlier that you treat them, the better they will respond. There are several cosmetic interventions that can help reduce the appearance of stretch marks. However, keep in mind that not all of them are safe to do during pregnancy or even during breastfeeding, and many will require a consultation with a dermatologist or a cosmetic surgeon. So topical retinoids can improve the appearance of stretch marks, but keep in mind these are not safe to use during pregnancy, and they are not safe necessarily to use during breastfeeding, so you want to check with your doctor before starting. They come in prescription strength, which is prescribed by a doctor, and they also come over the counter, which is less strong, but maybe worth trying it first. The one I recommend is called adapalene. Any form of topical retinoid is applied daily, usually at night, and it should be applied for at least 16 weeks. Generally, retinoids can cause a little bit of irritation, so you might notice some pinkness, even some scaling from topical retinoids. So you can also get treatments with lasers or other procedures such as microneedling or radiofrequency. These generally poke tiny little holes in the skin or target blood vessels or heat the lower level of the skin and basically tell the stretch mark to start healing. These treatments can also be quite costly. They may require multiple visits and multiple treatments, and they do require a consultation with a dermatologist or a cosmetic surgeon. These procedures are not safe in all skin types. If you have darker skin, then sometimes these can result in actually hyperpigmentation or further darkening of the skin, and oftentimes are not safe during hot summer months if you're getting a lot of sun. That can also lead to hyperpigmentation. So just something to consider and to talk to your physician about. So I think all of us wish there was some sort of magic bullet for treating stretch marks, but hopefully you came away with at least a few tips on how to treat them when they arise. Let me know in the comments if you have any questions related to stretch marks.